If you've been hanging out here for a bit, you know that there are many confidential agreements that stand between you and your healthcare. So today, I'm going to give you a couple of examples of how that affects both your health and your wallet. For those of you that haven't been hanging out here, my name is Allison DePauli, and I started Altiqe Consulting to help employers like you get budgeting predictability with the happy side effect of lower out-of-pocket costs and better access to high-quality care for your employees. If you like what you hear, hit the subscribe bell and be notified when we upload new videos. All right, so how does this affect you? There are many agreements between different kinds of healthcare providers. Pharmacies, drug manufacturers, PBMs, doctors, outpatient facilities, inpatient facilities, drug wholesalers, providers, carriers, all of that kind of gets in this cloud up here, and you're below that. All right, so let me give you two examples of how that affects you. One is pretty personal and not quite too common. CPT 74177 is an abdominal CAT scan. In 2019, the highest price for that service was $5,981.12. The lowest, $418.46. The average was $1,677. What did Medicare pay? About $270, depending on where you live. And we have a direct contract provider that will do that scan almost anywhere in the country for $205. Now, those scans are mostly read by computer before they are passed on to a radiologist, and that's what you're paying for. I would rather pay on that low end and not on the high end. So that's one aspect. And let's talk about something a little bit more serious now. Knee replacements. Now, I know there's a lot going on here, and I have fabulous handwriting, so bear with me. One of my providers did a study a few years ago comparing knee replacement costs and quality metrics in 4 metropolitan areas: New York City, Delaware, Duluth, Minnesota, and Portland, Maine. The average price for a knee replacement, all in, facility fee, surgeon fee, anesthesia, whole 9 yards, average $71,000 in New York City, $30,000 in Delaware, $41,000 in Duluth, and $50,000 in Portland, Maine. To give you some idea of how that compares to Medicare, in New York City, 595% of the Medicare cost. In Delaware, 253, 346 in Duluth, and 413 in Portland, Maine. So that's a pretty big difference over the cost of Medicare. All of these little dots are the different prices that were paid for that surgery at that facility. All right, so that's all the different PPO networks, all the different kinds of contracts, all the direct contracts, all the cash pay prices, everything in there. The green dots, okay, see, they're all on the bottom end. Those are the quality metrics. So I think most of you are like me, and I would rather have the highest quality provider doing my surgery rather than somebody else. And the thing that always surprises people is that those high quality providers, they're generally not at the bottom of the cost. Sometimes they are, but not always, but they're usually in the bottom quartile. So not only is driving to high quality care the right thing to do for humans, it is the right thing to do for your budget. So if you want to hear more about this, if you want the actual slides or a little bit more information, let me know below. Thanks.